Namaste, everyone. I'll start the first presentation, which is regarding breast cancer and screening. So, those of you who do not know me, my name is Madhu, and I'll be talking to you about cancer awareness. So, I recently retired from my role was advanced radiographer in Salford. I was a governance manager in the last 5 years. And then prior to that, most of my career was spent as a CT lead. And now I'm lead anti-cancer community champion and also volunteered for Asian Women Cancer Group in Harrow. So what I want to do is, first of all, I'd like to pay my dedication for all my cancer work to my loving, dear late brother Pankaj. And I connect with him from my soul. So, what is cancer? Cancer is a disease caused by normal cells changing so that they grow in an uncontrolled way. The uncontrolled growth causes a lump called tumor. So આપણું આખું શરીર કણ કણથી બનેલું છે અને એ કણ જીવિત હોય છે. સો એ જીવિત કણ ઉગે અને નાશ થાય, ઉગે અને નાશ થાય, પણ એ વ્યવસ્થિત રીતે થાય. જ્યારે એ ઉગતા હોય અને અવ્યવસ્થિત રીતે ઉગે ત્યારે એમાં ગાંઠ થાય. અને એ ગાંઠ બે પ્રકારની હોય, malignant અને benign. So malignant is when જે સેલ હોય એ બધા પ્રસરે શરીરની અંદર અને એને આપણે ટ્યુમર તરીકે ઓળખીએ કે કેન્સર તરીકે. So when I'm thinking about the body, every day I listen to my meditational master, and what rings bell to me about body. He always says that your body is a precious gift given to us by nature. So કુદરતે બનાવેલું આ શરીર એ કણ કણની કાળજી લેવી એ આપણી ફરજ થાય છે. સો મેં ઘણું હમણાં લિટરેચર વાંચ્યું. સો એમાં મને ઘણું દુઃખ થાય છે કે શું તકલીફ શું છે કે આપણા માણસો છે ને એમને જ્યારે બ્રેસ્ટ કેન્સર થાય છે તો એ લોકો એડવાન્સ સ્ટેજમાં હોય છે. કારણ કે એનું કારણ એ છે કે એ લોકોની જાણ નથી, એ લોકો પાસે જાણ નથી, આપણી પાસે જાણ નથી. અને એથી એમનું કેન્સર શરૂઆતમાં મળતું નથી. That's the reason we've gathered here together and formed a group, and this is the event we're exactly trying to do, to learn together and bring cancer awareness. So let's talk about breast cancer now. So breast cancer is the most common cancer in the UK. 1 in 8 women develop breast cancer in their lifetime. One person is diagnosed every 10 minutes. So even men can develop breast cancer. There are 370 cases every year. So early detection reduces mortality and saves life. So એ જીવ બચાવી શકે છે જો આપણે શરૂઆતમાં કેન્સર મળી જાય ને તો. So breast screening saves life. More than 18,000 cancers are diagnosed through screening. એટલે આપણે જે સ્ક્રીનિંગ ટેસ્ટ હોય ને આપણે એ કરાવીએ ને તો તો એ કેન્સર બહુ શરૂઆતમાં મળી જાય છે. So let's have a look at some risk factors, and these are some of the risk factors. So gender is the first thing, it's most common in the female, but it's also cancer rarely in men. It's also age related. Over the age of 50 are more likely to get cancer. And if there is any previous cancer history, that is one of the risks. Also family history, જો કુટુંબમાં કોઈને blood relative ને હોય, mother, father, sisters, so there are more chances of getting that breast cancer. So નાનકડા ઉંમરના હોય, younger than 50, should let the GP know. So there's also genetic risks, which are a little bit complicated, and there are known factors that affect breast cancer. So periods, જો 12 વર્ષની નીચેની ઉંમરમાં શરૂ થયા હોય કે પછી, અને જો મેનોપોઝ 55 વર્ષ પછી થયો હોય કે પછી 30 વર્ષ પછી પોતાના બાળકનો જન્મ થયો, after 30, then there are more risks of getting breast cancer. So let's look at the tool which is used for breast, what is involved with breast screening program. So breast screening program is for 50 to 70-year-old, and it extends from 47 to 73 in some areas. So આ છે ને સ્ક્રીનિંગ પ્રોગ્રામ 50 થી 70 વર્ષના માટે પ્રોગ્રામ છે, અને એ તમને લેટર આવે, અને એ લેટરમાં તમારે ટેસ્ટ કરાવવા જવાની જરૂરિયાત હોય. So people who receive letters are female who are registered with their GP. So, and women are invited every 3 years. So after 71, women can opt in for screening, because recently there's a case 1 in 3 women who get breast cancer are over 70. So if there are, you can opt in. But if you're younger than 50 and you have any symptoms, then you must contact your GP. So now I'm just going to share this, what mammogram is. The breast screening tool is a mammogram. Just bear with me, because
my name is Melon Coburn.
Can you hear the video?
Mm-hmm.
Thank you very much. So this આ ટેસ્ટ જે વિડીયો છે ને ઇંગ્લિશમાં જ છે, અને એ સમજાવે છે કે તમે બ્રેસ્ટ સ્ક્રીનિંગ કરવા જાઓ તો તમારે શું એક્સપેક્ટ કરવાનું અને કેવી રીતના ટેસ્ટ કરે છે. આ રોયલ વિક્ટોરિયા ઇન્ફર્મરી ન્યૂકાસલનો વિડીયો છે. સો તમે આ જોશો ને તો તમને ખ્યાલ આવશે.
My name is Melon Coburn. I'm an advanced practitioner with Newcastle Breast Screening Service. A mammogram consists of 4 x-rays, 2 of each breast. It can be uncomfortable, it can be very uncomfortable, especially if the lady has tender breasts in the first place. It's best if the lady can relax, that helps enormously, and usually the ladies that have been before know what to expect. The breast is imaged from 2 different angles, as you would x-ray any other part of the body almost. With each x-ray, the breast is actually compressed between 2 plastic plates, which is the uncomfortable part. We also want to see the muscle at the back of the breast, which involves stretching the arm slightly across the machine. My job is to put the ladies at ease and to get the best possible films on that day. We're looking for changes in the breast tissue, and if the lady has been x-rayed previously, we will have the previous films to compare with when we get them back to base. We see ladies in the screening programme from age 50 to 70, and we see these ladies every 3 years. In the hospital situation, we see various other groups, including the family history ladies, more often. The family history ladies are generally young women whose mothers have had breast cancer or a near relative has had breast cancer at a young age, and our genetics department looks after these ladies. What I'm looking for is a technically good film to give the best possible picture to the radiologists to look at to make any diagnosis that they need to. The breast screening programme is very important for ladies between 50 and 70 years of age, and they are invited every 3 years for breast screening. When we invite them for breast screening, all the advice is given in leaflet form within their invitation. Everyone who works in the breast screening service is professional at their job, good at their job, trust them, really, and try and relax. And it's a much easier process.
So next, I'm just going to look at women surviving breast cancer for 5 years or longer by stage diagnosis. So 99.8% of survival rate when breast cancer is diagnosed in the early stage. એટલે જો શરૂઆતમાં જો ડાયગ્નોઝ કર્યું હોય ને તો 99% એ સર્વાઈવ કરી શકે છે અને જીવન લંબાઈ છે એટલીસ્ટ 5 વર્ષ સુધીનું. અને એને compare કરીએ ને, when you compare it with latest stage is 28%. So isn't that wonderful that we pick up cancer really early and 99.8% survive. So now I'm just going to discuss how to do the second part of or how to do the second part of self-examination. And the screening, this is what everyone can do at home. And both men and women need to examine on the same day of the month, every month. And if you're pre-menopausal woman, then you do it week after your period, but choose, say, 5th day or 7th day to examine. So my presentation of this self-examination is from breastcancer.org, and I've used knowyourlemons.com as well. So there are 4 steps that we need to do for self-examination. So step 1 is to face the mirror, shoulders are straight, arms on the hips, look out for changes for shape, size, and color. So શરૂઆતમાં તમારે મિરરમાં જોવાનું અને હાથ આવી રીતના રાખવાના વેસ્ટ આગળ, અને મિરરમાં શું જોવાનું છે? શેપ કે કંઈ બદલાવ નથી ને? જો આવી રીતના લેમનનો શેપ છે એ કંઈ બદલાવ નથી ને? કલર, orange peel color or ratash che, is there any soreness of the skin? Has the nipple retracted at all or sunken in? Is there any fluid coming out of the nipple? If people are, fluid coming out from people who are not pregnant or breastfeeding. So that's what you look out for on step 1 and step 2. Step 2 is to be done exactly in the same way, but with the arms up. So third step is lying down. So when you're lying down, use your right hand, and if the right hand is kept above the head and rested on a pillow or a towel. And with the left hand, use the 3 fingers as pads and do a circular movement. There are 3 movements. You choose one movement to examine routinely every month. So either use a circular movement, or you can use ઉપરથી નીચે પણ તમે કરી શકો અને ઉપરના ચેસ્ટનો ભાગથી બગલનો ભાગ, હાંસલીનો ભાગ અને abdomenનો ઉપરનો ભાગ or chestનો ભાગ એવી રીતના તમારે એક્ઝામિન કરવાની. You can use 3 types of pressure by putting 3 types of pressure: gentle pressure, medium pressure, or high pressure. So what do you look out for is there any thickened area of the skin? ચામડીમાં જરાય કઠણ થઈ ગઈ છે કે જાડી થઈ ગઈ છે? ક્યાંય ગાંઠ છે, lump or bumps? કઈ veins દેખાય છે? dimple છે ક્યાંય? nipple sunken થઈ ગયું છે કે nippleમાં dry skin થઈ ગઈ છે એકદમ? This is what you look out for in step 3 and 4. In the step 4, you do exactly the same and by raising your arm. And this time, I think using the shower or when you're in the shower is easier because it's soapy solution and it's easier to do. So this is how there are applications available to support you if you're not actually taken this in. So the application I've actually seen is knowyourlemons.com. That's a free application. I've also got there are a lot of YouTube videos available as well. And I looked at several videos, and these 2 links I thought were quite good. એક હિન્દીમાં છે ને એક ઇંગ્લિશમાં છે. જો તમને મદદ જોતી હોય ને નાનકડા ગ્રુપમાં આ બાબતમાં કેવી રીતના એક્ઝામિન કરવું એનું શોર્ટ સેશન જોતું હોય તો તમે ચાર્ટમાં લખશો તો નાનકડું ગ્રુપ કરીને અમે ફ્યુચરમાં સમજાવી શકીએ. So that's 2 essential part. So હવે it's my turn to find out whether you've been listening to me. So I would like you to get your pens and papers out, and I'm going to, there's a quiz. So we're doing a quiz. So in the quiz, I just like you to write your answers in the chat, and I will be revealing you the answer straight away. So also write down, there are 10 questions, so how many you get right. Don't be embarrassed because if you don't understand something, then you won't get that right. And it's important for us and for me, as well as you, that you've understood what I've actually talked about. So let's start. Time starts now. So કઈ ઉંમરની લેડીઝને બ્રેસ્ટ સ્ક્રીનિંગનો ટેસ્ટમાં આમંત્રણ આપે છે? સો તમારો આન્સર આપો ચાર્ટમાં. 25 to 39, 41 to 49, 50 to 70, or D? Well, Monibin, you are really great because the answer is correct.
Quick.
And Jaishriben, yes, so age 50 to 70. C is the answer. So ladies are invited every 3 years. So what is a mammogram now? Anybody? Mammogram એટલે શું? બ્રેસ્ટ કેન્સરનું નામ છે કે પછી નોર્મલ બ્રેસ્ટ ગ્લેન્ડનું નામ છે કે પછી એક્ઝામિનેશનના ટેસ્ટનું નામ છે? Well, I've got some kind of X-ray exam of breast. Wow, wow! I've got four good answers. Yes, it's a breast screening examination. એટલે બંને બે X-ray કરે અને breastનું medical નામ is mammary gland. એટલે mammary gland માંથી એનું નામ mammogram પડ્યું. So next is men can attend for a breast screening. True or false? માણસોને પુરુષને breast screen કરવાની જરૂર હોય? True, Daksha. True, yeah, answers coming in. Surajben, true, yes. So the reason being, now I'll reveal that. જો આપણે પુરુષ હોય એ નાન્યંતર જાતિના પુરુષ હોય જે સ્ત્રી તરીકે જેનો જન્મ થયો હોય પણ એ લોકોએ એમની જાતિ બદલાવી છે ઓપરેશન કરીને તો એ લોકોની અંદર હજી સેલ્સ હોય જે સ્ત્રીના સેલ્સ હોય so they can turn cancerous. So transgender men, if they are registered only as females with the GP, then they will be invited. But they need to have a screening test. So breast cancer is most common cancer in the UK. True or false? Come on, quick, types, quickly. I wouldn't. True or false? True. Yes. So breast cancer is most common, yes. So 15% of new cases are diagnosed. So men can get breast cancer too, true or false? Men can, yes, it's true. Men can get breast cancer, 370 cases every year. And yesterday, talking to Kirit, our development worker from Answer Cancer, he mentioned that there is a man who's working in Answer Cancer who actually did get breast cancer, and he's a survivor. So, the gland is for men as well as women. So 1 in 8 women will develop breast cancer in their lifetime. True or false? Yes, Damayanti Ben. Thank you. So 1 in 8 women will develop breast cancer. There are 56,000 new cases in UK every year. 150 new cases every single day. So what percentage of women will survive their breast cancer if caught early in stage 1? Wow. And really impressed with all these people who've actually coming up with that percentage, 25, 63, 85, 98. Yes, it's 98%. Well done, folks. How often should women check their breasts? It's not just women, men should check as well. So I'm correcting myself. Once a year, once a month, once a week, once a day. Monthly, yes. Should check every month at the same time, same calendar. So the risk of breast cancer is higher in people with family history. True or false? જે કુટુંબમાં હોય તો ચાન્સ વધારે છે breast cancer નો. સાચું કે ખોટું? Answer is true. Yes. Taz, nice to see you actually taking part. Breast screening can save your life. True or false? Breast screening saves your life is absolutely true. Breast screening does save lives. So my key message to you today is check breasts regularly. If there's anything different or unusual, see your GP. Don't wait until your next mammogram. જો તમે મામોગ્રામની અપોઇન્ટમેન્ટ મિસ કરી હોય ને ઓર એક્સરે ટેસ્ટની તો પાછી શરૂ કરાવો કારણ તમારે જીપીને કહો કાં તમારે જે સ્ક્રીનિંગનો લેટર હોય ને એ લોકોને પાછી રિંગ કરીને પાછી શરૂ કરો સો માણસો જે રેગ્યુલરલી સ્ક્રીનિંગ ટેસ્ટ અટેન્ડ કરતા હોય જે લોકોના સેલ્ફ એક્ઝામિનેશન કરતા હોય અને એ લોકોનું જો કેન્સર થાય તો અર્લી ડિટેક્ટ થાય સો અર્લી ડિટેક્શન સેવ્સ લાઈફ so breast cancer screening saves lives so last slide is the key message I would like you to take away in today's screening side of it that make sure you monthly do the self checks. If it's unusual, see your GP. Early detection saves life. So NHS breast screening could save your life. So thank you very much for that. Namaste.
Thank you, Madhuben, for that. That was really good, very interesting, very detailed as well.
Thank you.
The next item is Dr. Rajani. If you can please unmute yourself and start your presentation, please.
Hi, everyone. Thank you, Mother Auntie, for that really, really helpful presentation on screening. So I'm going to talk to you about what happens when you start getting signs and symptoms before the screening happens. Okay, so the screening is really good because it picks up lumps before you can sometimes even feel them or see them. So it's really important that you do your screening. But what happens when you're not under the screening program or you're in the screening program and you notice some changes? So I'm just going to share my screen. If you could just give me a thumbs up just to say that you can see that, that would be great. Can our host see it? Is that okay?
Yes,
Yeah?
I can see.
Perfect. Great.
Thank you.
So we'll jump right in. So for those of you that don't know, my name is Divya Rajani. I'm one of the GPs here in Manchester. And I'm going to talk to you about the signs and symptoms. So all you need to remember are these things. If you remember these, I think it would be enough for you to say that you understand what the signs and symptoms of breast cancer are. So we're going to talk about the lump, structure of your breasts, your nipple area, the skin on your breasts, and finally pain. So let's talk about lumps first. So what does your GP need to know when you felt a lump on your breast after you've done the examination that Mother Auntie discussed? So the first thing is this a new lump? Have you had it for your whole life, or is this something that is new? The second thing is you want to feel the lump and you want to decide whether you think it's hard or soft. So when it's soft, it feels a little bit like rotli no dough, you know, when you press the rotli dough. But when it's hard, you can't press it, you can't squeeze it. The next thing that your GP would want to know is the lump, is it fixed in one place or is it moving around your breast? Is it very soft and moving, like we describe it as a mouse, or is it just in one place? Then where is the lump? Now, because of the COVID pandemic, right now, a lot of GPs are doing their consultations initially over the phone. So if you're describing where the lump is, a good way of describing it is to think of a clock and try and describe where the lump is if it was on a clock face. So you can say 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock, and say which breast it's in. Usually when the breast lump is on just one side of your breast, that is more worrying than if you have lots of lumps on both of your breasts. Then the GP, it would be helpful for the GP to know that, is the lump painful? The reason for this is that there are many causes of painful lumps in your breast. And this can be anything from an infection, from you getting hurt and getting some blood in the breast, to it being something serious like a breast cancer. And then the last thing that the GP will need to know is this lump related with your period at all? Have you noticed it in the week before your period? Does it go away after your period? And I'll explain a little bit about why that is in a moment. So those are the things that you're looking for when you are telling your GP about a lump. Now, when the timing of the lump is quite important, because if you are somebody who's having regular periods, it is quite common for you to have lumpy breasts in the week before your period. And normally this lumpiness will settle after you've had your period, so after you've had the bleeding. So it is important that you keep an eye on this if you're not sure, and then report that to your GP. The next thing is the structure. So how many people, if you could just write in the chat box, please, how many people actually feel comfortable looking at their breast in the mirror? Okay, so looking at the breast in the mirror can sometimes feel a bit of an awkward thing, but I think really we should encourage the ladies that are here today and the men as well, that you should regularly look at your breast in the mirror, okay? The reason for this is that you know your body the best, okay? Your body's with you all the time. And if there are changes, you're going to be the first person that's going to notice. Unlike other cancers, people aren't necessarily seeing your breast. So it's usually you that's going to spot that first. So I very much recommend that on a monthly basis, you look at your breast as a part of the self-examination in the mirror. So what you want to look for firstly is the breast even on both sides? So is the size even? It's common and normal for your breast not to be 100% the same size, but roughly it should be the same size. Are they feeling swollen or are they growing? Can you see any large veins on your breast that are sticking out? Again, if you're very fair-skinned, you will see veins, the color of your veins through your skin. But if they're large and you can actually feel them a bit like a worm, then that would be something that you would need to see your GP about. Also, it's very important to feel your breast. So you look at your breast and then you feel your breast. And you're looking for any thickness, any rubbery feeling. It really feels like a rubber that you rub a pencil with, this thick texture. Again, this would be concerning and you should see your GP about this. Women often tell me that the way that they know that their shape size has changed is that their bra or their blouse might not fit as well as it normally does on one side. If this happens, it's not usually a sign that you've gained a lot of weight, because it doesn't tend to happen on one side when you've gained weight. When you've gained weight, your whole blouse won't fit you. But when it's something serious that you need to see your GP about, it will usually be on one side. Okay. Then the nipple area. So this is the central area on your breast. What I want you to look for is look at your breast in the mirror regularly so that you know what is normal. If you start developing any eczema, so that's itchy, flaky skin around the nipple, or there's any liquid coming out of your breast, unless you are breastfeeding, this should, or you're pregnant, this should not happen. You should not have any liquid blood coming out from the nipple area. And the way to test for this is you use your thumb and your first finger, and you very gently squeeze the nipple area to see if anything is coming out. And you do that as a part of your breast examination. The other thing is that your nipple might start going flat, or in some cases, the nipple actually sinks into the skin. All of these signs, see your GP. Then skin changes. So these are often very subtle things that can be a very early sign of breast cancer. So are you getting any dimples in your breast? The orange peel, if you've ever looked at an orange peel, this picture here shows you what the skin actually looks like. And next to it, you can see this orange peel. So these tiny, tiny little spots that start to occur, they're like little dimples. And they have the same feeling as if you were touching an orange peel. If that occurs, then again, you should see your GP. If your skin on your breast starts becoming red, very hot to touch, you need to see the doctor, because this could be a sign of breast cancer, but it could also be a sign that you've got an infection in your breast. It's very important that this is treated very quickly, because if it spreads, you can become very unwell. Again, the flaky skin can be on anywhere on the breast tissue, and you might find some bruising or soreness of the breast that could alert you that this is a sign of breast cancer. And finally, pain. Now, I've left this to the last because actually this is a very uncommon symptom of breast cancer. So most of the people I see in my clinic who are worried about breast cancer actually come to me with pain. So they don't have any lumps, any nipple changes, any skin changes, but they're getting periodic pain in their breast. And normally I can reassure them because pain is a very late sign of breast cancer. And it's usually very severe, the pain, by the time it presents, if it is related to breast cancer. So if the pain is continuous and severe, usually affecting one breast, then you would need to see your GP. It shouldn't be cyclical. So I always tell ladies, if they've not got any breast lump, any nipple changes or skin changes, and they've just got pain, I would advise them to wear a supportive bra. Possibly, if they can, use a like an ibuprofen type gel on the breast and wait until their period is complete to see if the pain gets better. If it does, it's very likely that this is period related breast pain. So just want to reiterate, anybody that's getting breast pain, this is a very uncommon, it's the least common symptom of breast cancer that we see, okay? But it's a common symptom that people in the public get quite often and they worry and panic. So hopefully that's a bit reassuring for you. So my key messages are that, you know, even within our South Asian community, everybody's breast will vary in shape, size, and color, depending on what your natural skin color is. It's very important for you to know what is normal for you, that you check your breast every month. And like Mother Auntie said, if you are having periods, I would say 1 week after you have completed the bleeding. If you spot something, it's really important that you go and see your GP, okay? Because they may be able to reassure you, or they may be able to refer you urgently. And we know the sooner you get referred and the sooner it gets picked up, your survival rate is almost 100%. So you really, really need to invest some time in this. You shouldn't feel shy about examining your breasts. You can do it, you know, in the comfort of your own home, and nobody needs to know about it. So please, if you aren't regularly examining your breast, if there's one thing you've learned today, please, please make it a New Year's resolution that you will start doing it once a month. Okay, that's the end of my presentation. So we listened to your feedback from last time's event. And you'd really asked us to continue with our survivor stories. So I'm really pleased to say that today we've got another cancer survivor with us today. Her name is